So, ladies and gentlemen, I'm very pleased that I get the opportunity here today to discuss my concept of non-local consciousness based on scientific research on near-death experiences in survivors of cardiac arrest. And later in my lecture, I want to discuss into detail the transformational after effects of this experience. An NDE, or an experience of enhanced consciousness during a period of apparent coma, still gives rise to many unbelieving and critical questions, especially by physicians and neuroscientists. How can it scientifically be explained that people can have clear memories from a period of obvious unconsciousness? Or how is it possible that permanent life changes occur after cardiac arrest of only 2 minutes? An NDE is the unforgettable confrontation with unlimited dimensions in our consciousness. And as long as one has not experienced an NDE himself, it seems impossible to really understand the impact and the life-changing after effects of this overwhelming experience. The existing worldview has radically changed. Quote, "It felt as if I had become another person, but with the same identity." And another quote, "You can be physically dead, but your mind lives on. Only one thing matters, your attitude toward other people. I accept life as it is, and I'm not longer afraid of death." I will not only talk about changes in consciousness during and after an NDE, but first I would like to discuss my ideas about the relationship between consciousness and the brain. Important questions for me were: how is consciousness related to the integrity of brain function? Is it possible to gain insight in this relationship? And is there a biological basis of consciousness anyway? We can distinguish between both temporary and timeless aspects of our consciousness, and this prompts the following question: is it possible to speak of a beginning of our consciousness, and will our consciousness ever end? I realize that my approach will be new or unexpected for most neuroscientists, and that my conclusion will not always be in conformity with the currently widely accepted materialist paradigm in Western science. And I also realize that many aspects of consciousness are still a big mystery, because, as the well-known philosopher David Chalmers has said, consciousness, the subjective experience of an inner self, poses one of the greatest challenges to science. Even a detailed knowledge of the brain's working and neural correlates of consciousness may fail to explain how or why human beings have self-aware minds. So the question is, how can scientific research on NDE help us to understand more about this mystery of human consciousness and about the mystery of the mind-brain relation? So let us ask some questions about consciousness. How could it be explained that some patients can describe conscious experiences during general anesthesia, or during coma, or during cardiac arrest, that they even are able to describe into detail what has been said and done? And could we, based on these reports, even consider the possibility that there could be conscious experiences after someone has died, when his body is cold? He who wants answers has to ask these questions. And by asking exactly these questions, my interest started in near-death experiences. In 1969, during my rotating internship, a patient was successfully resuscitated at the coronary care unit by electrical defibrillation. And we mostly do not realize anymore that about 50 years ago, all patients with cardiac arrest died because modern resuscitation techniques like defibrillation and external chest compression were not yet available. But these patients regained consciousness after a period of about 4 minutes. And we as a resuscitation team were of course very happy. But the patients seemed to be very, very disappointed. It was all new. We were very positive about it, but he wasn't. He told me about going through a tunnel, seeing a light, and also beautiful colors and hearing music. I have never forgotten this event, but I did not do anything with it. And in that time, I did not know that in human history, the same experiences have been told in many cultures, in many religions, and in all times, as is shown in this painting from 1480 by the Dutch painter Bosch, showing deceased people escorted through a tunnel to the light. And only years later, in 1975, Raymond Moody first described these so-called near-death experiences. And only in 1986, I read about these experiences in a book by George Ritchie, Return from Tomorrow. From this moment, I started to interview my patients who had survived a cardiac arrest. And to my great surprise, within 2 years, 12 patients out of 50 survivors of cardiac arrest in the past told me about their NDE. So for me, it started with scientific curiosity, because according to our current medical concepts, it is not possible to experience consciousness during a cardiac arrest when circulation and breathing have ceased. I grew up in an academic environment in which I had been taught that it was obvious that consciousness was the product of a functioning brain. But now the phenomenon of near-death experiences raised a number of fundamental questions. How and why does an NDE occur? And how does the content of an NDE come about? Why does a person's life change so radically after an NDE? And I was unable to accept most of the answers to these questions because they seemed incomplete, incorrect, or unfounded. But first, what is an NDE? Some people who have survived a life-threatening crisis report an extraordinary conscious experience. And an NDE can be defined as a reported memory of a range of impressions during this special state of consciousness, including a number of universal elements, such as an out-of-body experience, pleasant feelings, seeing a tunnel, a light, deceased relatives, a life review, or the conscious return into the body. And many circumstances are described during which NDEs are reported, such as cardiac arrest, clinical death, shock after loss of blood, complicated childbirth, coma following traumatic brain injury or stroke, near drowning, children, or asphyxia, but also NDE-like experiences are reported in serious diseases not immediately life-threatening, during severe depression, isolation, or meditation, or without any obvious reason. And NDE-like experiences can also occur during the terminal phase of illness and are called deathbed visions or end-of-life experiences. So apparently, you don't always need a non-functioning brain to report an NDE. NDE is transformational, always causing the loss of the fear of death, profound changes in life insight, and enhanced intuitive sensitivity. This is why these kind of experiences are also called spiritual transformative experiences, or STE. Now, near-death experiences occur with increasing frequency because of the improved survival rates resulting from modern techniques of resuscitation and from better treatment for patients with cerebral trauma. The content of an NDE and the effects on patients seem similar worldwide across all cultures and all times. However, the subjective nature and the absence of a frame of reference for this experience lead to individual cultural and religious factors determining the vocabulary used to describe and interpret the experience. Children and adults, Christians and atheists, Muslims and Buddhists, they all use different words from their own religion, culture, and tradition. And according to a recent at random poll in Germany and the USA, about 4% of the total population in the Western world should have experienced an NDE. So more than 10 million people in the USA and about 20 million people in Europe must have had an NDE. Now, why do we physicians hardly ever hear a patient tell about their NDE? Patients are so reluctant to share their experience with others by all the negative responses they get. Patients must feel that they trust you, that you can listen without any comment or prejudice. But for most physicians, the NDE is still an incomprehensible and unknown phenomenon. Once a conference was held about NDE in a university hospital with more than 300 people in attendance. And at the end of the conference, after several lectures about NDE, a man stood up and said, "I am a cardiologist for more than 25 years, and I have never heard such absurd stories. This is total nonsense. I don't believe one word of it." And then another man got up in the audience and said, "I am one of your patients. I have had an NDE during cardiac arrest, and you would be the last one I would ever tell." Patients feel exactly that these kind of physicians are not able to listen at all. Until recently, there was no prospective and scientifically designed study to explain the cause and content of an NDE. All studies had been retrospective and very selective with respect to patients. And based on these incomplete retrospective studies, some believed that the experience could be caused by physiological changes in the brain as a result of lack of oxygen, cerebral anoxia. Other theories encompass a psychological reaction to approaching death, hallucinations, dreams, side effect drugs, or just false memories. So in 1988, we started a prospective study of 344 consecutive survivors of cardiac arrest in 10 Dutch hospitals with the aim to investigate the frequency, the cause, and content of an NDE. And this cartoon was published in a Dutch national newspaper when our study was published in the Lancet in December 2001. We wanted to know if there could be a physiological, pharmacological, psychological, or demographic explanation why people experience enhanced consciousness during a period of cardiac arrest. And we did a short standardized interview with sufficiently recovered patients within a few days of resuscitation and asked whether they could remember the period of consciousness and what they recalled. And additionally performed a longitudinal study with taped interviews of all late survivors within the 2 and 8 years following the cardiac arrest, along with a matched control group of survivors of cardiac arrest who did not report an NDE. And I will discuss the result of this longitudinal study later in my lecture. Now, we studied patients who survived cardiac arrest because it is a well-described, life-threatening medical situation, which is also called clinical death. And the definition of clinical death was used for the period of unconsciousness caused by lack of oxygen or anoxia of the brain due to the arrest of circulation and breathing that happens during cardiac arrest in patients with an acute myocardial infarction. And these patients will ultimately die from irreversible damage to the brain if cardiopulmonary resuscitation, CPR, is not initiated within 5 to 10 minutes. It is the closest model of the process of dying. In case memories were reported, we coded the experiences according to a weighted core experience index. And in this system, the depth of the NDE was measured according to the reported elements of the content of the NDE. The more elements were reported, the deeper the experience was. And we found that 282 patients, 82%, had no recollection of the period of cardiac arrest, of the period of unconsciousness. However, 62 patients, 18%, reported some recollection of the time of clinical death. And of these patients, 41, 12% had a core experience with a score of 6 or higher, and 21, 6% had a superficial NDE with only 1 or 2 elements. Now, which elements were reported? In our study, about 50% of the patients with an NDE reported awareness of being dead or had positive emotions. About 25% of the patients had an out-of-body experience. 30% reported moving through a tunnel, and about 25% had communication with the light or with observed colors. About 30% of the patients had an observation of celestial landscape or had meeting with deceased relatives. 13% experienced a live review, and 8% experienced a border. So in our study, all well-known elements were reported except a frightening NDE, but I have personally met really some patients who had a frightening NDE as well. Now, what might distinguish the small percentage of patients who report an NDE from those who do not? We found to our surprise that neither the duration of cardiac arrest, 2 minutes or 8 minutes, nor the duration of unconsciousness, 5 minutes or 3 weeks in coma, nor the need for intubation in complicated CPR, nor induced cardiac arrest in electrophysiological stimulation, EPS, had any influence on the frequency of NDE. NS is not significant. So the degree or gravity of the lack of oxygen in the brain, anoxia, appear to be irrelevant. So a physiological explanation for NDE like anoxia could be excluded in our study. Neither could we find any relationship between the frequency of NDE and administered drugs, fear of death before the arrest, nor foreknowledge of NDE, that you know that these experiences are possible. Gender, religion, atheist or Christian didn't matter at all, or education. Now, in 4 prospective studies with identical study design, our Dutch study, which is still the only study with statistical analysis, 1 study from the USA by Bruce Grayson, and 2 studies from the UK, about the same percentage of NDE was found in a total of 562 patients who survived a cardiac arrest. And all authors conclude that no one physiological or psychological model by itself could explain the common features of an NDE. So Bruce Grayson writes in his comment that the paradoxical occurrence of heightened lucid awareness and logical thought processes during a period of impaired cerebral perfusion raises particular perplexing questions for our current understanding of consciousness and its relation with brain function. A clear sensorium and complex perceptual processes during a period of apparent clinical death challenge the concept that consciousness is localized exclusively in the brain. And Sampani and Peter Fenwick from a British study write that the data from several NDE studies suggest that the NDE arises during unconsciousness. And this is a surprising conclusion, because when the brain is so dysfunctional that the patient is deeply comatose, those cerebral structures which underpin subjective experiences and memory must be severely impaired. Complex experiences such as reported in the NDE should not arise nor be retained in memory. Such patients would be expected to have no subjective experience at all. And Pennacetori from the other British study concludes that according to mainstream science, it is quite impossible to find a scientific explanation for the NDE as long as we believe that consciousness is only a side effect of a functioning brain. The fact that people report lucid experiences in their consciousness when the brain activity has ceased is, in her view, difficult to reconcile with current medical opinion. So with a lack of accident for any other theories for NDE, the concept this far assumed but never scientifically proven that consciousness and memories are produced by large groups of neurons and are localized in the brain should be discussed. How could a clear consciousness outside one's body be experienced at the moment that the brain no longer functions during a period of cardiac arrest, a period of clinical death, even with a flatline EEG? Scientific study of the NDE pushes us to the limits of our medical and neurophysiological ideas about the range of human consciousness and the mind-brain relation. Perhaps the NDE could be considered as a changing state of consciousness, based on the theory of continuity of consciousness, in which memories, identity, and cognition with emotion functions independently from the unconscious body and retain the possibility of extrasensory perception. Obviously, during NDE, enhanced consciousness is experienced independently of the normal body-linked waking consciousness. Now, before I discuss in greater detail some neurophysiological aspects of the brain function during cardiac arrest, I would like to reconsider certain elements of the NDE. And first, the out-of-body experience. In this experience, people have veridical perceptions from a position outside and above their lifeless body. NDEs have the feeling that they have apparently taken off their body like an old coat. And to their surprise, they appear to have retained their own identity with the possibility of perception, emotions, and a very clear consciousness. And this out-of-body experience is scientifically important because doctors, nurses, and relatives can verify the reported elements, the reported perceptions. And they can also corroborate the precise moment the NDE with OBE occurred during the period of CPR. In 2 reviews with more than 150 corroborated reports of potentially verifiable out-of-body perceptions, it was found that more than 90% of the reported OBs were completely accurate. Through verification, it was proven that all reported perceptions during coma, cardiac arrest, or general anesthesia were about details that really had happened. And based on these veridical aspects, an OB cannot be, by definition, an hallucination or nor a delusion, nor an illusion. Moreover, one needs a functioning brain to have an hallucination, illusion, and delusion, and the brain doesn't function at all during cardiac arrest. Now, a real OB is really shown in this drawing from a 6-year-old girl who nearly drowned and was resuscitated in a hospital in the US. In this drawing, you see a happy and smiling girl looking at the resuscitation from above. As she draws here 2 nurses who are doing chest compression. A girl of 6 doesn't know anything about CPR. She really saw her own resuscitation. And this is a report of a nurse in the coronary care unit. During night shift, an ambulance brings in a 44-year-old cyanotic, comatose man in the coronary care unit, and he was found in coma about 30 minutes before in a meadow. And when we go to intubate the patient, he turns out to have dentures in his mouth. I removed his upper dentures and put them onto the crash cart. Only after about 1 hour and a half, the patient has sufficient heart rhythm and blood pressure, but he's still ventilated and intubated, and he is still comatose. So he's transferred to the intensive care unit to continue the necessary artificial respiration for 1 week. So after more than a week in coma, do I meet again with the patient who is by now back on the cardiac ward. The moment he sees me, he said, "Oh yes, you know where my dentures are." I'm very, very surprised. And then the patient elucidates, "Yes, you were there when I was brought into hospital. And you took my dentures out of my mouth and put them onto that cart. It had all these bottles on it. And there was this sliding drawer underneath, and there you put my teeth." I was especially amazed because I remembered this happening while the man was in deep coma and in the process of CPR. It appeared that the man had seen himself lying in bed and that he had perceived from above how nurses and doctors had been busy with his CPR. He was also able to describe correctly and into detail the small room in which he has been resuscitated, where he was admitted in coma and had left in coma, as well as the appearances like those present, like myself. And then the holographic live review. During this live review, the subject feels the presence and renewed experience of not only every act, but also of every thought from one's previous past life. And one realizes that all of it is an energy field which influences oneself as well as others. All that has been done and thought seems to be significant and stored. Because one is connected with the memories, emotions, and consciousness of another person. You experience the consequences of your own thoughts, words, and actions to that other person at the very moment in the past that they occurred. Interconnectedness. Patients survey their whole life in one glance. Time and space do not seem to exist during such an experience. Non-locality. Quote, "All of my life up till the present seems to be placed before me in a kind of panoramic, three-dimensional review, and each event seemed to be accompanied by a consciousness of good or evil, or with an insight into cause and effect. Not only did I perceive everything from my own viewpoint, but I also knew the thoughts of everyone involved in the event as if I had their thoughts within me. This meant that I perceived not only what I had done or thought, but even in what way I had influenced others, as if I saw things with all-seeing eyes. And so even your thoughts are apparently never wiped out. And all the time during the review, the importance of love was emphasized. Looking back, I cannot say how long this live review and live insight lasted. It may have been long, for every subject came up, but at the same time it seemed just a fraction of a second, because I perceived it all at the same moment. Time and distance seems not to exist. I was in all places at the same time, and sometimes my attention was drawn to something, and then I would be present there. And it is also possible to come in contact with the consciousness of deceased relatives, deceased persons. Interconnectedness. Quote, "During my cardiac arrest I had an extensive experience, and later I saw, apart from my deceased grandmother, a man who looked at me lovingly, but whom I did not know. More than 10 years later, at my mother's deathbed, she confessed to me that I had been born out of an extramarital relationship, my father being a Jewish man who had been deported and killed during the Second World War. And my mother showed me his picture. The unknown man that I had seen more than 10 years before turned out to be my biological father." Some patients can describe how they returned into the body, mostly to the top of the head, as they had come to understand that it wasn't their time yet, or that they still had a task to fulfill. The conscious return into the body is experienced as something very oppressive. They regain consciousness in their body and realize that they are locked up in their the damaged body again, meaning again all the pain and the restriction of their disease. Quote, "When I came to in my body, it was dreadful, so dreadful. The experience had been so beautiful that I didn't want to come back. I wanted to stay there. And yet, I came back. And from that moment, it was a real struggle to live my life inside my body, with all the limitations I experienced at the time. But later, I realized that this experience was in fact a blessing. For now I know that the mind and body are separate and that there is life after death." And about all people who have experienced an NDE lose their fear of death. Quote, "It is outside my domain to discuss something that can only be proven by death. For me, however, this blessing experience was decisive in convincing me that consciousness lives on beyond the brain, or beyond the grave, and I know now for sure that body and mind are separated. Death was not death, but another form of life." So we have to come to the surprising conclusion that in our study during cardiac arrest, all these reported elements of an NDE were experienced during a transient functional loss of all functions of the cortex and of the brainstem with a flatline EEG. Now, how do we know that the EEG is flat in those patients, and how can we study this? Through many studies with induced cardiac arrest in both humans, like threshold testing and ICDs, and in animals, cerebral function has been shown to be severely compromised during cardiac arrest with complete cessation of cerebral flow, causing the clinical findings of the sudden loss of consciousness, the loss of breathing, apnoe, the loss of all body reflexes, the function of the cortex, but also the loss of all brainstem reflexes like the gag reflex, the corneal reflex, and fixed and dilated pupils. And the electrical activity in the cerebral cortex in humans, and also in deeper structures in the brain in animals, has been shown to be absent after 10 to 20 seconds, a flatline EEG. So in an acute myocardial infarction, the duration of cardiac arrest is always longer than 20 seconds. So all 562 patients of cardiac arrest in the 4 prospective studies must have had an NDE. Now, it is extremely rare that a simultaneous registration of the electrical activity of the heart, the ECG, and of the cortex of the brain, the EEG, during cardiac arrest could be monitored. We show already, this slide was shown already on Friday. A patient was referred to loss of consciousness and and the upper line here, the black, is the EEG, the electrical activity of the cortex, and the red line here is the ECG, the electrical activity of the heart. Now here is a spontaneous cardiac arrest and its history. And about 8 to 10 seconds later, the EEG changes already due to anoxia. And after 80 seconds, the EEG is flatlined as well. Each spike is here 10 seconds. The total registration is 60 seconds. And after 30 seconds of an S history, there is a ventricular tachycardia, and the activity of the heart comes back, and also the activity in the brain comes slowly back. It's not yet a normal EEG. The conclusion about conscious experience during a flatline EEG is called impossible and unscientific by most academic and materialist scientists. However, the quite often proposed objection that the flatline EEG does not rule out any brain activity because it is mainly the registration of the electrical activity of the cerebral cortex, misses the mark. The issue is not whether there is any brain activity of any kind whatsoever, but whether there is the measurable brain activity of the specific form regarded by contemporary neuroscience as a necessary condition for conscious experiences, with visible activities in many neural centers, the so-called global neural workspace. And it has been proven that there is no such specific brain activity at all during cardiac arrest. So for me it was indeed a scientific challenge to discuss new hypotheses that could explain the possibility to have clear and enhanced consciousness during an transient period of a non-functioning brain, with memories, with self-identity, with cognition, with emotions, with the possibility of perception out and above the lifeless body, to explain the reported interconnectedness with the consciousness of another person and of deceased relatives, and to explain the possibility to experience instantaneously and simultaneously non-locality, a review or even a preview of someone's life in a dimension without our conventional body-linked concept of time and space, where all past, present, and future events exist, and even to explain the experience of the conscious return to the body. So here I would like to quote Robert Oppenheimer, the famous American theoretical physicist, who has said, "There is no place for dogma in science. The scientist is free and must be free to ask any questions, to doubt any assertion, to seek for evidence and correct any errors. But the majority of materialist scientists still don't believe in the possibility to experience an enhanced consciousness during a period of non-functioning brain. And they try to debunk everything I have said and written by simply stating that it is obvious an NDE must be produced by the brain. They only change their mind as soon as they have experienced an NDE themselves, like Eben Alexander, Mary Neal, Bettina Peter, and many, many other physicians. So my advice to these debunkers is, try this small and dangerous footpath and find out yourself. In my book, Consciousness Beyond Life, which was a bestseller with more than 250,000 copies sold worldwide, I've written that based on prospective studies on NDE, based on recent findings in neurophysiological research, and based on concepts from quantum physics, our consciousness cannot be localized in a certain time nor space. And this is called non-local consciousness, beyond time and space. And in this concept, our endless of non-local consciousness with declarative memories finds its origin in and is stored in a non-local realm as wavefuls of information. And the brain only serves as a relay station for parts of these wavefields of unconsciousness to be received into or as our waking consciousness. So the function of the brain should be compared with a transceiver, a transmitter-receiver, or interface, exactly like the function of a computer. Different neuronal networks function as interface for different aspects of our consciousness. And the function of neuronal networks should be regarded as receivers and conveyors, not as retainers of consciousness and memories. In this concept, non-local consciousness is non-rooted in the measurable domain of physics, our manifest world. However, the physical aspects of consciousness, which originates from the wave aspects of our consciousness during collapse of the wave function, the objective reduction, can be measured by means of neuroimaging techniques like EEG, fMRI, and PET scan. And with this concept of non-local consciousness, all reported elements of an NDE during cardiac arrest could be explained. Now, in trying to understand this concept of interaction between a non-local consciousness and the material body, it seems appropriate to compare it with modern worldwide communication. There is a continuous exchange of objective information by means of electromagnetic fields for radio, television, mobile telephone, or laptop computer. And at this very moment, we are invaded by hundreds of thousands of telephone calls and hundreds of radio and television programs. But we become only aware of these electromagnetic informative fields at the moment we use our mobile telephone or by switching on our radio, television, or laptop. What we receive is neither inside the instrument nor in the components, but thanks to the receiver, the information from the electromagnetic fields, the cloud, becomes observable to our senses, and hence perception occurs in our consciousness. Internet with more than 1 billion websites can be received at about the same time in the USA, in Europe, and in Australia, and it is obvious not located inside our laptop, nor is it produced by it. Information from internet is always and everywhere available because it is stored in the cloud. Now, this concept can be compared with non-local consciousness. It's always everywhere available. So I want to tell more about the results of our longitudinal study, where we wanted to know if objective criteria, like changes in life insight and the loss of the fear of death, are only the result of the subjective experiences of an NDE, or could they be also be caused by the cardiac arrest itself? And this has never been studied before in a prospective design. In our taped interviews of all late survivors with NDE 2 and 8 years following the cardiac arrest, along with a matched control group of survivors of cardiac arrest who did not report an NDE, we found that there was a striking and statistical difference in transformational after effects between people with and without an NDE. The second interview after 8 years showed that in people with an NDE, the fear and death in particular had significantly decreased, while belief in an afterlife had significantly increased. It struck us that after 8 years, the people without an NDE also were undergoing some unmistakable process of transformation. Nevertheless, clear differences remained between people with and without an NDE. And we were also surprised to find that the process of transformation that had begun after 2 years had clearly intensified after 8 years in people with an NDE. I will now discuss the different aspects of the transformational after effects in people with an NDE, and I will not only refer to the findings of our longitudinal study, but I will also refer to the hundreds and hundreds of personal meetings and thousands of emails from all over the world from people who shared their NDE with me. And I will also refer to findings of the NDE literature. In my discussion of the after effects, I will distinguish between psychological, physical, transcendental, and social after effects. Oh. There it is. So first, the psychological after effects. The NDE remains a largely unfamiliar and misunderstood phenomenon, as society cannot readily accommodate this kind of spiritual experiences, or perhaps even better, spiritual trauma. The resulting tension can lead to psychological problems. Talking about the NDE is usually impossible. Prejudice means that when people do try to broach the subject, they are often misunderstood and or even more ignored or ridiculed. The depth of the experience, and above all, the panoramic live review and encounter with the light, appear to contribute to the intensity and inevitability of these transformational after effects. Popular literature tends to concentrate on the positive nature of these changes, yet many people struggle to accept and integrate their newfound insight, especially when faced with the negative reactions from their partner, with a divorce rate of more than 70%, and from family, friends, and healthcare practitioners. These are called interpersonal problems. And after an NDE, the insight no longer rests on faith, but on certainty and inner knowing. And in fact, the life changes derive in no small measure from the new insight in life, and that death is not the end of everything we are. Quote, "It has such a profound effect on the rest of my life. The timelessness that I experience, the knowledge that my consciousness will survive outside my body. It was enough to destabilize my life." For obvious reasons, most people feel nostalgic about their NDE because of the unforgettable feelings of peacefulness, of total acceptance, and of indescribable joy, and of unconditional love they encountered during the experience, and the feeling of being forced to return back into the damaged body. So the NDE is also a traumatic event, because there is at first hardly any acceptance by oneself, which makes the process of coming to terms with the experience is so difficult and painful, with years of strong feelings of depression, loneliness, and homesickness. And these are called intrapersonal problems. And also personality traits of the person prior to the NDE, such as extroverted or introverted character, or a positive or gloomy disposition, are important factors in this process. If dealing with unexpected situations was always a challenge, coming to terms with an NDE is much harder. Cultural factors play a role too. Within Western culture, the experience is completely at odds with conventional wisdom. And it is no surprise that people who were raised in material values find it much harder to accept the new insight that money and power are no longer essential to happiness. The social support of family and friends is crucial, and the skeptical response of most healthcare workers and relatives is a source of extreme frustration to NDEs. I've come across people who were unable to talk about the NDE and its consequences for more than 50 years after the event. For fear for rejection, they kept the NDE for a lifelong secret. Quote, "I knew nothing of NDEs. I thought I was the only one, and I had the impression that others thought I was a bit loopy." And these people had found it extremely difficult, if not impossible, to live their lives according to the newfound insights. The transformations reported by people with NDE differ widely, both in terms of content and in terms of the rate of acceptance and integration. The passage of time between the NDE and the interview seems to be a significant determining factor to the degree to which the processes of change have been accepted and integrated. The longer this interval, the more positive changes are reported. In other words, the processes of change will vary significantly depending on whether people are interviewed within 1 year or only after 25 years after the NDE. Most studies about changes after NDE provide a clear picture of the various aspects of the process of change, but they do not offer reliable figures on the incidence of the changes and of the exact time which they occur, which is a limiting factor for the interpretation of these changes. In 2004, the Dutch psychologist Igor Corroborated carried out a survey in the Netherlands asking 84 people about their problems coming into terms with their NDE. And by the time of the survey, it was done an average of 24 years, 3 months to 77 years after the NDE, most of the problems had been dealt with to some degree of satisfaction. The results also showed that the higher the percentage of positive responses to their personality changes, the better the NDEs were capable of dealing with the problems. That said, an average of 24 years after the NDE, still more than half remained incapable of communicating effectively about their experiences. Describing the sensations and full awareness of a deep spiritual experience like an NDE seems next to impossible. An NDE is indeed an ineffable, but also an ultra-real experience. And the memory of the experience persists over time and remains vivid, and it is also retains the original details. People will never forget it. The absence of unconditional love in human relationships also continued to be a problem for more than half of the respondents. And this survey, also the psychopathology of the 84 NDEs was measured on the basis of a symptom checklist. The symptoms in people with NDE included the aforementioned interpersonal problems, by the negative interaction with others, and the intrapersonal problems like depression due to the difficult acceptance of the forced return into life. Compared to the general population, an average NDE scores higher in psychopathology, but still noticeably lower than the average client who is referred to as psychologist. And the score is much lower than the average psychiatric patients. The only slightly raised score might suggest that the NDEs have relatively few mental problems. However, the opposite is true. It was found that about 20% of the NDEs had a higher psychopathological score, which means more severe psychological problems than the average psychiatric patient. Now, the physical after effects. People not only experience psychological problems, they also report important physical changes. The NDE can precipitate hypersensitivity, hyperesthesia to bright lights, in particular sunlight, and also people frequently prefer to wear sunglasses. In fact, the experiences can trigger a heightened sensitivity to all sensory impressions, such as sound, taste, touch, and smell. So the NDE can also result in a greater sensitivity to loud noises, a desire for silence, and a newfound preference for soothing music. So people often prefer to use earplugs. Quote, "After my NDE, I felt like a child learning how to walk. The world around me overwhelmed me. I couldn't find any place in the world. For months I couldn't bear light and noise, television and radio, not even music, which I used to love. Sometimes I think I've got a new problem because I've become hypersensitive to too much noise." So some people can no longer stand the physical proximity of their partner. And sometimes there is a change in sleeping patterns. There are also reports of synesthesia, a phenomenon in which sensory impressions influence one another. People affected in this way talk of seeing smells or hearing or smelling colors, for example, smelling red. Some people experience an increased sensitivity to alcohol and develop an allergy an allergy to conventional medicine, which then sparks an interest in complementary and alternative medicine. There are frequent reports of electrical phenomena, in particular at emotionally charged moments. The body can emit an electromagnetic field that interferes with electrical equipment. Lights go out, the computer crashes, the car starter fails, or the supermarket checkout scanner reviews the service. Quote, another strange thing that after my NDE, every piece of equipment I touched, such as lamps, dishwasher, kettle, the light in the cooker hood, it broke. I gave off energy everywhere. Some people do not wear a watch after the NDE because it stops as soon as they wear it on their wrist. Thinking that the watch is broken, they buy a new one, only to have the same thing happen. So look around now to see how many people of you wear a watch. It's striking, isn't it? Then the transcendental after effects, enhanced intuitive sensitivity. The conversations we had in our longitudinal study, as well as in the personal meetings and in email exchanges, also revealed that people, often to their own amazement and confusion, had acquired enhanced intuitive feelings after an NDE, or as many of them put it, they had acquired paranormal gifts. This enhanced intuition is based on interconnectedness with the non-local consciousness of others, and is independent of time, and in the knowing of future events or having prognostic dreams, and is independent of distance, the sense of knowing about an incoming phone call, and of pain, illness, or upcoming death of people, which usually proves to be accurate. This is called non-local information exchange, because this information is not received by our senses nor by our body. And this enhanced intuition explains clairvoyance, clairaudience, telepathy, prognostic dreams, premonitions, visions, and remote viewing or non-local perception. Presumably, the functional receiving capacity of the body is permanently enhanced following an NDE, which can be compared with a radio, receiving not only channel 1, your own consciousness, but at the same time channel 2, 3, 4, and 5, the consciousness of others. William James called this a lower personal threshold of consciousness. And the sudden occurrence of this enhanced intuition can be quite problematic, as people suddenly have a very acute sense of others, which can be extremely intimidating. As someone told me, I couldn't even talk about it, or I would have been committed to an institution. And I know people who have been committed to an institution because they keep on talking about it. Post-mortal experiences, or after-death communications, ADC, are still a huge taboo in the Western world, despite the fact that about 125 people in Europe and about 100 million people in the USA must have had such an after-death communication, which is usually the spontaneous experience during sleep. But the enhanced reception ability for aspects of non-local consciousness in people with an NDE also leads to the possibility to be able to have contact with the consciousness of deceased people by choice. So they sometimes can function as a medium. People sometimes discover the ability to emit healing power to others, which enables them to help people with physical or psychological problems. They have become a kind of instrument that can receive and transfer universal or divine healing energy. There are also reported cases of a self-healing capacity after an NDE, like Anita Morjani and many, many others. Another after effect is sometimes the ability to see auras. Even children sometimes spontaneously report seeing all kinds of beautiful colors around people. Equally, NDEs are often aware of invisible energy fields with which they can help others. Indeed, some decide to volunteer in the palliative and terminal care, not just to share the insight that death is not the end, but also to help and support terminal and dying patients by bringing peace of mind and by alleviating pain. Then the social after effects. Obviously, the near-death experiences turn out to be a life-changing experience. The newfound insight pertains that what matters in everyday life, compassion and unconditional love, including acceptance of one's own dark side, which is the most difficult aspect as well, and also feeling compassion and unconditional love for others and for nature. It also pertains to insight into connectedness. Everything and everybody is always connected. And this is why some people describe the NDE as an experience of unity or an experience of oneness. They speak of a cosmic law in which everything they do to another person or to nature will ultimately have an effect on them too. And this applies to both love and affection and to violence and aggression. The loss of the fear of death also changes people's outlook on life. Some aspects of life become important while others become completely irrelevant. After an NDE, people only want to spend more time and energy to think of lasting value. Almost all ephemeral and material things have become less important. People display a greater appreciation for ordinary things, whereas their interest in possessions and power has decreased. A big house, an expensive car, a lot of money, competition, this all has become less important. People also identify much less with their own body, believing it to be merely the physical, material aspect of someone's personality. The NDE can evoke the sense that the old self has died and that a new person has been born. The NDE and its subsequent changes are thus experienced as a spiritual death and rebirth. Although religious affiliation declines, people usually report an increase in religiosity and in greater interest in spirituality and questions about the purpose of life, and also in meditation, prayer, and surrender. Generally speaking, people's religious sentiment increases after an NDE, while their interest in organized religion declines sharply. So it's quite remarkable to see a cardiac arrest lasting a few minutes give rise to such a lifelong process of transformation. A summary: there is no such thing as a classic NDE or a classic way of dealing with it. Each person with an NDE is different. The often difficult and painful process of coming to terms with the NDE and the resulting positive changes depend on the depth of the NDE, the personality structure, the cultural background, and above all, social factors. As I told before, many people struggle to accept and integrate their newfound insight, especially when faced with negative reactions from their partner and from family, friends, and healthcare practitioners, because especially friends and family often struggle to accept the personality change that occurs after an NDE. So the integration and acceptance of an NDE is a process that may take many years because of the far-reaching impact on patients' pre-NDE understanding of life and value system. And as I mentioned before, despite the mostly positive experiences, the NDE is almost a traumatic event. It is a spiritual trauma, because there's hardly any acceptance by others, which makes the process of acceptance and integration very difficult. And this process will take many years with strong feelings of depression, loneliness, and homesickness. But the longer the interval between the NDE and interview, the more positive changes are reported. So, having discussed the findings of several important scientific studies on NDE and its after effects, one can conclude that they challenge our current concepts about consciousness and its relation with brain function. And the conclusions are important for our scientific concepts in the Western world, because this view of consciousness as a non-local phenomenon might well induce a huge change in current paradigm. Such understanding also fundamentally changes one's opinion about death, because of the almost unavoidable conclusion that at the time of physical death, consciousness will continue to be experienced in another dimension in which past, present, and future is enclosed. Quote, "Death is only the end of our physical aspects." I believe now that death, like birth, may be a mere passing from one state of consciousness into another. Remarkably, in a recent representative social poll in Europe, between 50 and 60% of the population, more than 250 million people, believed in some kind of personal survival. And in the USA, this percentage is even higher. And these surprising high figures are in sharp contrast with the opinion of the majority of Western scientists, who systematically ignore and ridicule the possibility of personal survival after physical death. However, we should acknowledge that research of NDE cannot give us the irrefutable scientific proof for the conclusion that the death of the body is not the end of our consciousness, because people with an NDE did not quite die, but they all were very close to death and with a non-functioning brain. So, what we could prove scientifically, that during NDE, enhanced consciousness was experienced independently of brain function. And quoting from a recent death announcement, "All what you have falls to decay, but what you are lives on beyond time and space." So we have a body and we are conscious. Without a body, we still can have conscious experiences. Recently, someone with an NDE wrote to me, "I can live without a body, but apparently my body cannot live without me." One cannot avoid the conclusion that endless consciousness has and always will exist independently from the body. There is no beginning, nor will there ever be an end to our consciousness. The NDE seems to be a personal rediscovery of wisdom and insight that is ages and ages old and has been well known in many cultures and at all times, but nowadays seems to be forgotten. I would like to quote Plato, who wrote about 2,500 years ago, "The temporary material body is the temporary carrier of our immortal soul, and time does not exist in the immaterial world," according to Plato. So based on NDE research, one can conclude that our enhanced consciousness does not reside in our brain, nor is it limited to our brain, because our consciousness is non-local, and our brain has a facilitating and not a producing function to experience consciousness. After 32 years of studying NDEs, since 1986, I can assure you that I learned quite a lot because of all those patients who were willing to share the NDE with me, as they have greatly changed my views on the meaning of life and death. People with NDE have been my greatest teachers. My current view is now, as I've already stated before, there are good reasons to assume that our consciousness does not always coincide with the function of our brain, and hence consciousness can sometimes be experienced separately from the body. And I'm aware that this concept can be little more than stimulus for further study and debate, and above all, we should question the purely materialist paradigm in science. I believe and hope that in the near future, modern science will include empirical research on unusual subjective experiences that may occur in our consciousness, and that we will accept non-local concepts to understand how we are interconnected with each other and with our endangered planet. So regarding what we can learn from people with an NDE, I would like to quote Dag Hammarskjöld. Our ideas about death define how we live our life. Because as long as we believe that death is the end of everything we are, we will give our energy toward the temporary and material aspects of our life. And our short-sightedness and sometimes willful ignorance, we forget to reflect on the future of our planet, where our children and our grandchildren will have to live and survive. We forget about the sustainability, as we are now destroying and exhausting systematically our planet, just because we are living in a competitive and materialistic society. We should stop thinking and acting as if we are better than others, because this will always be at the expense of children and other weak and delicate creatures around the world. We should realize that the harm we cause to each other and to nature ultimately is harming ourselves. Because as humans, we are not only intensively interconnected and tangled with each other, but also with animals and plants living on our endangered earth. I hope that in the near future we will accept non-local concepts to understand how we are and always will be interconnected with each other, also after physical death. And that we have to change our personal consciousness, not only to change the way we live, but also to change the way we want to treat, honor, and respect people who are willing and able to share their NDE with us. Their life changes in ways that they were not prepared for. And they all tell us that they fundamentally changed their ideas about life and death because, quote, you can be physically dead, but your mind lives on. Another quote, death was not death, but another form of life. Consciousness seems to be our essence. And once we leave our body, leave our physical world, we exist as pure consciousness, beyond time and space, and we are unfolded in pure, unconditional love. As a wizard, he wrote to me, when the power of love becomes stronger than our love for power, our world will change. It will require a huge change of consciousness indeed. And we should all feel the responsibility for this change. Thank you for your attention. Exactly.
I cannot study these people as objective subjects. They're my friends, and I love it. And it's apparent to me that you've also had, besides a change of mind and new ideas about consciousness, a change of heart. Can you share a little bit of that with us?
Well, it's obvious that I changed a lot. I started as a materialist scientist, and I learned in university and medical school that consciousness is a product of brain function. And when we started to the study of NDE in survivors of cardiac arrest, it took many years before I really could accept the change that consciousness is independent of the brain. And I learned what I told me, the NDEs have been my greatest teachers, because they learned me that death is not the end of who we are. So it changed for me the way I treat patients, the way I live, and I'm more sensitive to others. The way what I eat has changed as well, and I love to be in silence and to love to be in nature as well. So it changed me a lot indeed. You don't have personal NDE to change. When you are open, I also resonate with all the patients who share the NDE with me. You change as well.
Thank you very much, Dr. van Lommel, for all your research over the decades. Deeply grateful for that. I was just curious, relative to the subjective outcomes, and you mentioned you're hoping that in the future there's going to be more testing done on that. I was just curious, as coming up here, the electromagnetic interference of all this stuff with the watches and the lights and all that. Has anybody done any studies on that from a standpoint of kind of, statistical studies? Is there anything in the near future they're working on towards that to get like qualitative results?
Not as I'm aware of, but for me, consciousness is fundamental, which means that the electromagnetic activity of the brain is a product of our consciousness, and electromagnetic activity of people with NDE, that the body changes, is caused by changes in consciousness indeed. So all the physical aspects, like electromagnetic information, is a product or caused by consciousness. And I hope there will be some studies as well.
Doctor, I just want to thank you for critical thinking, systematic, empirical analysis that's non-emotional, non-subjective, and evidentiary. Because I think that the entire NDE movement needs scholarly, academic, critical thinking in order to self-understand and to communicate to the wider world. So I thank you very much for helping me.
Thank you. Thank you.
I will add my thanks as well, Doctor. One of the things I think you bring to this group and to our audience is an international perspective. And we're welcoming that very much. To much of what we see as Americans, of course, are the U.S. perspective, and we can sometimes be kind of isolated within ourselves. So I'd be interested in your opinion about how you see maybe the different cultural acceptances between the U.S. and Europe, and how you see that the acceptance in Europe compared to and what stage that is at. And let me just add one sub-question, which is, it strikes me that we often quote the statistics that there's 10 million NDE experiencers in the United States and 20 million NDE experiencers in Europe. And yet, unfortunately, it seems like many of the studies that we are doing are only among the hundreds of people. Why have we failed to reach levels of studies that are in the hundreds of thousands of people or millions of people? And where do you see that research going?
Yeah. Thank you for the question. First, about the changes. I think that in the Netherlands, and everywhere in the world, there's still a huge taboo about death. There's still a huge taboo about NDEs. But I lecture quite a lot also for medical schools, hospitals, hospices, etc. And I see that the younger generation, and especially also nurses, are much better. Physicians come a little bit slowly. The Netherlands is quite open, Germany is quite open, France is quite closed. Spain is much better as well, and Italy also. UK, not bad. But so we cannot generalize it. But I think there is always interest in these kind of studies. But it is a very slow process because of the huge taboo. And also because of the lack of funding for scientific studies as well. We did our prospective study, 10-year study, without any funding, but just the weekends, evenings, and holidays. So the problem is funding as well. For me personally, I don't need hundreds of thousands of reports. I think what we know now, based on the scientific studies done, we know enough. The second step is how we can include this insight and knowledge into the medical community and the general population at large. And that is the challenge we focus on now, I think. Thank you.